So we will discuss autologous fat transfer. So, so when we say fat, what do we mean? Fat is basically made up of two components. One is the fat cells; those are the adipocytes, and the second part is the stromal vascular fraction. The stromal vascular fraction is the part we are interested in, along with the adipocytes. So the adipocytes are the fat cells which may be in the abdomen or the flanks or in the legs. In these fat cells, there are blood vessels which come in and supply blood. So around these blood vessels are the SVF cells. So the SVF cells consist of stem cells, pericytes. Pericytes are endothelial cells. Pericytes are the peripheral endothelial cells, and other cluster of cells which work along with the stem cells and pericytes. So what we do is basically transfer both these adipocytes and SVF into other parts. So when we transfer these, the following things take place: volume enhancement. So volume enhancement is due to two parts again. A part of it is due to the adipocytes plus the stromal vascular fraction. So what happens is adipocytes are the fat cells which give volume, and the stromal vascular fractions give signals to the adipocytes to grow. So these are the stem cells, right? So these stimulate the adipocytes to grow further when we transfer the fat into any body part. So these are the places where we can do the volume enhancement. The other place, then we have rejuvenation. So volume enhancement plus rejuvenation we can do again in the all three places plus hands. So for the hands, what we have, we again transfer the adipocytes plus the SVF. As we age, so in the dorsal aspect of the hands, we lose the fat. Like I had shared photos before, we lose the fat. So with fat transfer, we fill this again, and the hands start looking younger. The veins also get hidden by the fat, and we inject the nanofat into the skin, that is intradermal, which leads to the rejuvenation effect. So the rejuvenation effect is due to the nanofat. Nanofat is destroyed adipocytes plus stromal vascular fraction. So the stromal vascular fraction is common in both, but instead of the live adipocytes, we destroy them by, like we do for foam sclerotherapy, we pass it in between two syringes through a three-way connector and destroy that fat, so that then it is easy to inject it through an insulin syringe. So like we inject PRP, we inject nanofat into the skin. So this nanofat injection can be done. So nanofat can be used for anti-aging skin. So we can do full face nanofat, just like we do full face PRP. So PRP and nanofat are complementary. So we can do full face nanofat plus PRP. This is a very new and interesting treatment with very good results of doing nanofat plus PRP. So basically, to summarize all this, what I'll show is uh, indications of autologous fat transfer. We have volume enhancement. Volume enhancement basically we can do in the under eye, we can do temples, we can, if a patient wants lip filler, so lip enhancement. If patient has thin lips, we can do lip enhancement if for thin lips. Then we can do for cheeks fat loss. Then we can do rejuvenation, anti-aging. So that we can do for uh, sun damage. We can do for pigmentation. Then we can do for wrinkles and age-related changes. Third, we can use for hair loss either nanofat or nanofat plus PRP. So this I didn't talk before. This indication again, like I said, the SVF contains stem cells plus we add PRP. So this act complementarily to stimulate the hair follicles. So this is like Regenera. So SVF is very similar to Regenera and we add PRP to it. So we can do it for hair loss. This is an important indication which we will start exploring. Then the fourth is for hand rejuvenation. So again, here we do both microfat plus nanofat. And the fifth is for acne scars. Again, acne scars, we do microfat to lift scars, and we do nanofat. Nanofat is intradermal, microfat is subcutaneous. So below the skin, in the skin, nanofat will help in collagen remodeling. So all this can be done by fat quite nicely. So when you have, so just to make you aware, under eye dark circles, temples, thin lips, cheek fat loss is all that we can do with for volume enhancement. That is mostly with microfat. But in these patients, the skin is also sometimes loose. So in the same patients, we can do rejuvenation or anti-aging with adding nanofat intradermal. In rejuvenation and anti-aging only, where there's no volume loss, we can do nanofat intradermal. For hair loss, again, there are papers SVF plus PRP. Very good indication, not much research papers. Like it is at a place where PRP was say maybe 10 years back. 10 years back there were no research papers on PRP, not many. Similarly, SVF. SVF per se is very similar to the Regenera that is famous. So we can do PRP plus SVF for hair loss. Then there's hand rejuvenation. We do both microfat below the skin and nanofat in the skin, intradermal nanofat, subcute microfat, and acne scars. So when you see patients, this is the indications that we can do with autologous fat transfer. So I'll explain now how we do autologous fat transfer. So there are three steps. The first is harvesting. Second is processing. And third is injection. All the three are done with a one. So harvesting is the step where in harvesting first we clean the area, usually the abdomen. Then we make a small hole, 1.5 millimeters only. Through that hole we inject tumescent anesthesia. So that tumescent anesthesia will numb the area. So if this is the abdomen, so we inject tumescent anesthesia in this area. Shubham, and we inject tumescent anesthesia, numb this area, and then inject. Then using a micro cannula, suck fat out. So this is the first step. In the processing, we purify the fat, isolate stromal vascular fraction, and in the injection, again we use a 0.8 millimeter hole, which is very small, about an 18 gauge needle, not 18 also, 21 gauge needle, so that's 0.8. We use a 21 gauge hole and inject microfat, subcute, and nanofat we inject intradermal. The whole procedure is quite painless as it's done under local anesthesia.